Welcome back to another episode of the IMGPH podcast. Yes, we're virtual again, but that's because we have somebody that's not in New York City right now, but is very, very well connected to the NYU community and has made massive strides, including, I would say, an NYU legend, a superstar here at NYU. We have Dr. Joe Boufford, a clinical professor at NYU School of Global Public Health, which is on my hoodie, and that's what Joe asked me to say as well. Uh, for those, most people at the school know who Dr. Joe is, and will probably hear about her, see her around. So there's no introduction necessary for Joe, but we'll get to learn a lot about her through the episode. We also have Reilly Fitzpatrick. Reilly did a dual degree, an MPH and MSW here at NYU, and is now working at the University of Kansas Center for Community Health and Development as the Director of Training and Technical Assistance. Reilly's also taught a lot at GPH from what I hear and has been heavily involved in the community. But more than them individually, this episode is about connection, connectivity, how a student can come and get connected to an amazing professor, faculty member, and lives can change, ideas can flourish, and you can move forward in your own public health journey. With that said, Joe and Reilly, welcome to the IMGPH podcast. Reilly, why don't you tell us about your NYU journey? How did you get introduced to this university? Why did you even choose to come here? What was your story?
I am a graduate of the MSW MPH dual degree program, class of 2023. So it's been a couple years now. But really, like many students, I think, that are interested in attending NYU, I wanted to move to New York City. I'm originally from San Francisco. And so I felt like it was appropriate that I try out the other coast, and really had considered NYU for undergrad, but decided it might be more appropriate for grad school. And so I received a Peace Corps. So I was in the Peace Corps before I applied to grad school. And when I returned, I started looking for different fellowship, scholarship opportunities. And there's a great one for returned Peace Corps volunteers at NYU for both the dual degree program. And so I decided to move here or there, New York, for school in 2020. So I got accepted, I think, in January, and the world changed very quickly. And so I still moved to New York during COVID and did my first year online. And it was an incredibly odd time to move and be in school and all that. But not for 1 second do I regret it, because I've loved my experience. And what drew me to the program really, I was interested in the concentration in global health. As I said, I was a returning Peace Corps volunteer, a health volunteer. And I was so deeply shaped by the relationships I built as a volunteer in Zambia. And so I knew I wanted to do work that focused on improving the conditions that affect the way people live. And this felt like a good opportunity to do so.
It seems like your experience at the Peace Corps in Zambia opened up a portal for you to even discover public health. Were you aware of the world of public health before that?
No, it's a great question. And I'm sad to say I was not. I was like many public health people, I was a medical student in training, or I had done a background in biology. That was my undergrad. And I started working in a nursing home, actually, as a clinical nursing assistant to try to get my hours to apply to school. And I realized there that there were many problems with the health system and the things that were affecting people. And I don't think I would have been able to name it at the time, but the things that were affecting outcomes were things like race, were things like people's economic status. And so I started to question it and decided I would do a crazy thing and join the Peace Corps. And that is really where my training in public health started. So you're exactly right. It was newer to me, but forever changed my life and trajectory.
I'm very excited to hear about where that took you after that. But I'd love to hear from Joe. You've seen many cycles of students at this school, and I can see evolution in mindsets coming in, or maybe it's rather similar. But quickly, how would you introduce yourself to someone that's never met you at GPH before, Joe? And what do you see? What do you sense when you hear this story from Reilly? Is this common with students? Are there all kinds of things you see in this program? What's coming up for you?
The first thing that came up is I think her journey into public health is almost the same as mine. It's really interesting. Now, I started out as a pediatrician and did my residency in the South Bronx in the late 70s and had exactly the same light bulbs went off that Reilly's describing, and realizing my patients, the healthcare piece was the least of their challenges and was actually quite a low priority, considering relative to shelter and jobs and food and going to school and things like that. So it's interesting. It was exactly the same arc. I'm the practitioner on the on the faculty. Most of what I bring to the school is just a lot of experience in the real world. I've been in and out of academia. I was the dean at the Wagner School of Public Policy, Public Service for 5 years, and on the faculty there, and then have been here for about 8 years. But the rest of my career has been mostly in government and in nonprofit sector, in healthcare delivery, health policy, global health. So I'm like a generalist. I connect what I do for a living is connect the dots among people that are working on the same issue and don't know about each other. And then the fun part of me, and for me in the school working with the students, is those students like Reilly that are interested in bringing evidence to the real world, making things happen, making change, making things better. That's what keeps me here and keeps me excited.
I mean, it's amazing what you have created. And I'm curious to hear from Reilly's perspective with this creation of a dual degree was available to you when you first started. Did you know you would go into a dual degree? Did you know you wanted to apply for this? Did you even know what you were signing up for? Just like the Zambia thing that you did. I have no idea that it's going to open up the portal in public health. So what happened for you as you were looking for a program and decided to choose NYU?
I don't think I knew I wanted to do the dual degree until I started looking and found out that was even an option. I knew that I really wanted a balance of perspectives. I wanted different lenses with which I could operate. So with social work, you get the micro side, right? You get the crafting of interpersonal skills, those relational skills that honestly are so important and transferable. So beyond just clinical practice, right? I use those skills in work. I use those in my relationships. But I knew that I wanted the scale and the impact and that micro or macro lens that the discipline of public health offers us. So I think both are really important. And I thought a lot about how I could develop different sets of skills. And I could do so in this program. And that's proven to be really true.
And then Joe, do you know that people are looking for a program like this? How is something like this even created that people discover themselves?
I don't know. I mean, I was delighted to see that there were dual degrees. I was the advisor for the dual degree programs in the school. So that's how I met Reilly first. But there's also dual degree with nursing, with medicine, and with public policy at NYU. So they're there. I mean, I think they realize that, as Reilly said, students want to develop a complementary set of skills that in academia, things tend to be a little bit more vertical in nature. So you have to put the pieces together. So that's how it happened. But it's really great program. The students are, in my view, the dual degree students are terrific because they're really ambitious and they're taking on a lot, and they're very committed to finishing the program in that way. So
we keep hearing on the podcast that public health is everywhere. Everything is public health. Public health is everywhere. And it's an indication that dual degree is just scratching the surface of what you can get into. I'm particularly interested in this idea beyond public health is everywhere into connection. And how on earth did the two of you get connected? I mean, you are an advisor. I feel like I see where this is going. But was it something more than that? How does someone connect with a faculty member who's new to the public health space?
Well, I mean, it was easy for me because Reilly's a superstar, so everybody was talking about her. So as soon as I met her, I said, okay, fine. We'll come back otherwise, but I'll let Reilly tell that part of the story.
The feelings are mutual with you, Joe. But yeah, like Joe said, she's the advisor for the dual degree students. And so I first met her in a virtual capacity during COVID years. And I remember her being so supportive, and you can hear it in this, of the pathway that I was on, the social work and public health. I remember her talking about what real value she could see in doing the dual degree. And it was nice to have that ally. And so I also had class with Joe. It was actually my first introduction to the global health program. At the time, it was Foundations of Global Health. And she's just a fabulous professor. She's engaging and passionate. She uses a lot of graphs in her slides. And for a nerd like me, I just love that. They say so much. And she carried high expectations for her students. And that's something that I really value. So not only was it the first time that I was exposed to global health issues on the scale that we got in Foundations, right? Things like health system strengthening, health in all policies, with urban health, which are all Joe's bread and butter. But I also had this incredible professor with lived experience, the practitioner side, who just delivered it so convincingly. So I really think that's where our relationship started. And then I started working for the department, and I got to know her better in person. And the rest is history.
How does this happen? I started working for the department. To me, sounds like a job or a role that's so hard to achieve or get to as well. It just seems like it happened. What does that involve for someone like you to get there?
Actually, I mean, something that I would recommend to all prospective students is speak up in class, be vocal in class, because it was actually so the program manager, Kira Block, who I'm sure everyone has mentioned at some point in this podcast series because she's amazing, but she sent out an email to folks. We were online at the time looking for a research assistant for the program. And she had happened to be in some of the classes that I was in and had heard me speak up. And this was a virtual setting, so things were very quiet. And I think I was the only one on camera and talking in one of these classes. So when I applied, she saw the application and said, I know this person. I recognize their name. I recognize their face. Let's give them a shot. So that was kind of my pathway in. And it was all virtual at the time. So we really didn't have a personal relationship. It was just speaking in class, making yourself known.
Is it similar to you, Joe? Or what are other things that stand out to you about students that get them on projects like this that could perhaps be life-changing or even mind-expanding and self-discovery is happening?
I think it's pretty much what Reilly said. I mean, one of the things, during COVID, there were you're teaching a class that has 30, 35 students, and there were maybe 6 or 8 students that had their camera on the whole time. And you can't help but, remember them. And I think they have their camera on because, they're going to be more talkative. They're not, hiding or, I appreciate people have complicated circumstances for why their camera isn't on or off. That's not the point. But the point is, you can see somebody's articulate. You can see they answer questions. You can see they're doing the reading. So you see a performance level. And I think that's, we have the opportunity as faculty to have class assistants for courses of a certain size and other sort of connection for me, because I'm more on the applied side, is really working with students on helping them find a field experience that they have to have. It's 180 hours in the field to get their MPH degree. For me, those are the biggest connections, but a lot of it is word of mouth. I mean, Kira is now the administrator for the Department of Global Health, and is always talent spotting. And so when the faculty come to her and say, I need a class assistant, I need a research assistant, she's got a inventory of folks that have shown they perform in the classroom, but they also sort of perform outside the classroom, and that they get these opportunities. And it makes a big difference. I think it makes a big difference for the student. It certainly makes a difference for the faculty member if the student is enthusiastic and interested and committed. But those links are easy to make, I guess, is the bottom line within the school and our Department of Global Health.
Yeah, ideally, it seems like if you're within the community, show up, raise your hand. Everyone's here to help each other, and it's if your enthusiasm is there, there's ample enthusiasm to support you over here to help you achieve your dreams and support a larger cause, which is what public health is all about. Speaking of that larger cause, what was the project that the two of you worked on? How did you both collaborate?
I'll start, and then Reilly can talk about it.
Yeah.
I'm the vice chair of the New York State Public Health and Health Planning Council, which has authority over certificates of need of getting licensed hospitals, licensed healthcare facilities, licensed to operate in the state of New York. And I'm focused a lot on the public health aspects of that. And so one of the project that we worked on most closely is something called community benefit, which is an obligation nonprofit, not-for-profit hospitals have to give money to invest in their communities in order to maintain their nonprofit status. Because in New York, all hospitals are nonprofit. There are no for-profit hospitals in New York. And so we had our eye on that source of funding, which one particular category in this overall set of obligations to report to the Internal Revenue Service, because it was aligned with something called the prevention agenda, which was there's something called Healthy People nationally in the United States, and each state kind of does its version of that. So the New York version was called Prevention Agenda. And what we wanted to do is basically figure out how to mobilize money to finance those improvement of these bad health statistics in communities in the state. And so I think that captured Reilly's imagination. It was very, very concrete. And she was, because she's so good, I mean, it took a lot of technical skill, but also a lot of patience. So I think I'll turn it over to you for that part, Reilly, because I think that was the biggest, alarm, sort of opening, or I guess light bulb in the process.
I mean, it was an amazing project. I knew nothing about community benefit before I met Joe. And I'm not sure you asked this, but I'll tell the backstory. I went to her trying to figure out what I would do for my applied practice experience. And she pitched this idea to do a policy analysis around community benefit. And the more I started learning, the more I saw exactly what Joe just said, right? This was a real opportunity for the state to harness a ton of money. And in public health, right? We're always looking for resources. We never have enough, right? Here's millions and millions of dollars that nonprofit hospitals have to spend and could be spending on programs, on things to make the community a better place, right? And the issue is that there is no federal requirement, right? This is really state specific. So what I did is I did a environmental scan across all the states to look at how different states dealt with this issue of community benefit. How were they increasing transparency around spending? Were there any requirements around how hospitals spent their money that they got? And the money we're talking about is money from tax exemptions, right? So they don't have to pay certain taxes because they get that nonprofit status. So really, we worked closely, and this showed me just what amazing of an advocate Joe is. Like, she does not give up. She does not give up. No, seriously. I mean, it is such a model for perseverance and commitment. And she's in a position where she can make a difference. Not everyone wants to hear it, but that doesn't stop Jo, right? Like, she still is having, and she just told me before you jumped on that they had a recent, I don't know actually if this can be on the podcast or not, but she's still doing this work and talking about community benefit because it's a huge opportunity for public health. And she sees that and she has the vision, so she goes for it. So I got to play a small role in, creating this policy analysis, providing recommendations for what New York State could do to align this with the prevention agenda and get money, mobilize those resources for public health goals. So I don't know.
Reilly's paper went to all of the people in a decision-making role at the state in the state. This was about a year and a half ago, I think, to show them what other states were doing, because that's how, Americans like to see what other states. New Yorkers are very competitive. We like to see what other states are doing and what other cities are doing, and it was show the differences and show what the opportunities were, and it really helped with the pitch, as Reilly said, to these folks. And I think I mentioned the word patience because Reilly hung in there for. You graduated and you stayed at the school, for another year or so, and this kept evolving. And she went down to some of the state public health council meetings and sat in and saw a lot of the strange and wonderful ways in which the public deliberates, appointed people deliberate on issues. But it's still in play. And I think that paper has been part of a portfolio that's been transferred on to new leadership in the department since she was here. And I think this not going away thing, it's really important. I was laughing with some state officials the other day. Somebody said, I just said, I really don't go away. You're still here and you take an issue and working on something. Sometimes it takes 5 years, 8 years, 10 years. And then you also realize, I think, and this is true in public health, because I think people tend to stay in places, even whether you're in a nonprofit, which is where you can be a super advocate and not be constrained by government roles, or in the for-profit sector for whatever. You keep going in an issue, and everything has its own time. I mean, timing is everything on an issue. It's not like, I don't think there's a whole lot new under the sun, but it may come up at a time when you can actually do something about it. So, as I was saying to Reilly, this is still happening, and there is language now, some of it, I think, influenced by her paper in the New York State governor's budget message last spring, charging the Commissioner of Health to come up with language to have hospitals report on community benefits. So it's still in play, even though your project was probably 3 years ago, or I don't know, 4 years ago maybe. But I think it's something. It's really interesting because it's real. I think the applied practice experiences that NYU, my experience, the same thing with the Wagner School. NYU is really committed to, making the city a better place. It's a private university in the public service. That's the tagline, but it's very real, and we're in a position to do things like that, which is very cool.
Reilly doesn't sound like a small role to me.
Oh, was it?
No. I'm a nerd, but I loved it. I loved it. I thought it was so, and yeah, as Jo said, I mean, I got to go to Albany and go to the FIPIC meetings and learn the process, and see and collaborate with people who were also interested in community benefit, that Jo connected me to, like brilliant researchers, right? Other people in the New York State Department of Health. So it was cool. It was really, like Jo said, it was practical. It was applied, and as a good AP should be.
AP, could you clarify that for those that don't know what AP is?
Yes, applied practice experience. That's a requirement, or at least when I was there, it was a requirement.
It is for the MPH,
for the MPH. Everyone has to do one.
It's beautiful to see the impact that this has had, because that was my next question. What impact has it had? And we've clearly got the answer to the question that state officials are making changes to how they are reporting and talking about things because of a paper that was written from the school and an amazing connection that happened between two people. So what I would love to leave with is asking the two of you. There are a group there. This world is going to be never ending in public health. and there's a new generation that's coming in. There's a current generation. There's the past generation as well. How would you how would you recommend the future students, current students, to connect with these faculty members? We have got some options as well that you have stated before. But what would be the way to pursue this public health degree as they come to NYU and make changes that are truly local and even global?
I believe I talked about making yourself known in class. For me, that was a real one, a real important one. Other ways are, getting involved on campus. I worked for the department, as I spoke about, and that was excellent exposure to faculty. But you can be a course assistant. That's another way. Showcasing yourself during class. But there are also really great opportunities. I'm sure the podcast has covered this, to join labs. Joe, you had a lab when I was there. You still have it. Okay, it's still going. Joe has one, and Dr. Dickey has one. So the different, I think Emmanuel or Dr. Pepra has one. So there are many ways, and that's real, hands-on work for different organizations, or it can be, that's facilitated through the faculty lead on that. So you get good exposure there. I just generally think that when you come into a program and you show that you care and that you're passionate and you're engaged, and that is earnest, right? You're not just playing a part. People notice that. So this work is so, public health is everywhere, right? There are so many different ways that you can go, directions that you can go within this field. So, use your advisors to try and figure out what that is. And I really think, I'm forever grateful for my NYU experience, and GPH specifically. I really loved it.
Yeah, just to reinforce, I think from the faculty point of view, the class performance we've talked about, I think also a lot of students, I think, are shy going up to a faculty member after a class and asking questions or asking to have a meeting or, something that sparks your interest. That's very gratifying. I think we like that. And a number of students, I think maybe even post-COVID, it's been a bit strange, but before COVID, I remember I used to meet with almost all of my advisees in person, at least once a year. And that I think everybody got virtual after COVID. And so I would encourage those that decide to matriculate to sign, when you're there is really every student is assigned an advisor, a faculty advisor, and meet with that person and introduce yourself, because we're the folks who write letters for you when you graduate, who help you get into internships, who recommend you when you want to get some other kind of activity. And it's really important to have a relationship with a faculty member. Reilly mentioned the labs, which I think there's something like 40 labs or something. There are a lot of labs in our school now. Mine's in urban health and focuses on projects. Others are research labs that work with a faculty member on their own research projects, Dr. Peppers, et cetera. So they are very highly varied as well. And those are voluntary. They're completely voluntary. So the student has to decide to do it. You're told what it is and you're given the opportunity. You don't have to go searching for it, but you have to decide to do it. And as Reilly said, it's like getting involved in the university and clubs and other things. The student has to decide to do that. And you got to balance that with your academic performance. But I think there are plenty of lures and opportunities and motivations for students at NYU and in the School of Public Health especially to get involved, because and I think Reilly said this, and you said it earlier, public health is everywhere, but part of the goal of the future public health professionals is being able to talk to everybody, whether you're in transportation or in government or in housing or in education or in the clinical space, is really having that conversation to figure out how you collaborate to improve the health of populations, individuals as well as populations and communities. So it's good combat training, I think, as a student, to get involved in lots of things beyond the classroom. That's what we want to see.
Well, that's absolutely beautiful. I really appreciate the two of you sharing these stories and insights. Without a doubt, I can tell that a new generation has been inspired. You're going to see similar projects like this coming up that has impact massive changes within communities and globally as well. And we really appreciate the two of you sharing the story. Any final thoughts or anything that's coming up that we haven't spoken about that's come to either of your mind before we close the episode?
I think the opportunity I haven't talked to Reilly in a while, so I'm going to have follow up and get a Zoom meeting so we can connect and catch up with each other. So that's great. Thank you very much for that, Aman.
Yeah. I've been thinking about you, Joe, and wanting to reach out. So this is a great opportunity to reconnect, because I want to let's update the paper. Let's get it real time. I'm in it.
We're gonna wait and see when the language starts coming out. What has to happen? Believe me.
Well, public health is about impact, everybody, but largely it's even more about connection. This doesn't happen without collaboration, and the story with Dr. Joe Ivey and Reilly has been evident to how people can connect and make an impact. So there are endless opportunities here. Show up. Thank you both for being on this episode. I'm sure a lot of people got a lot out of it. And I was also inspired. In fact, I had a tear to my eyes sometimes looking at how much of an impact it's had on Reilly, what impact it's had in the world. So really, really appreciate the two of you sharing your story.
Our pleasure. Thank you. Mine, Elite.
Thank you.
All right, folks. That was Dr. Joe Ivey Boufford and Reilly Fitzpatrick. We will see you all in the next episode. Thanks for tuning into this virtual episode, and take care. See you next time.